in which the immune system starts attacking your own body parts. The normal function of the immune system is to protect oneself from infections. Sometimes by mistake, it starts attacking different body parts, commonly joints, skin, or kidney. So we see many diseases under rheumatology, most common being different type of arthritis, like like rheumatoid arthritis. Just like rheumatoid arthritis, juvenile arthritis. Then there's one common disease called ankylosing spondylitis. Then we also see a common disease called lupus, connective tissue disorders, and fibromyalgia, osteoarthritis, osteoporosis, and vasculitis. So, like I said, the common ones are rheumatoid arthritis, juvenile or young age arthritis, spondyloarthritis, and lupus. So, in all types of arthritis, the common symptom are multiple joint pain and swelling. The common type of arthritis are rheumatoid arthritis, gout, which is caused by high uric acid levels, osteoarthritis, which is the age-related wear and tear arthritis, ankylosing spondylitis, and other spondyloarthritis. So there are some myths about arthritis which I like to discuss today. One is arthritis is not treatable. A lot of people, once they are diagnosed with arthritis, they feel there is no treatment, there is no cure, there is no, you'll have to just live with it. It can only get worse and eventually they'll be bedbound. This is not true. It's a chronic disease. It is treatable. However, it is not curable, but it is treatable. Many people feel that it is related to diets such as curd or other sour, khata foods. Many people also feel that uric acid causes all types of arthritis. They have symptoms of joint pain and swelling, and their uric acid is normal. So they are very confused why they have arthritis despite the uric acid being normal. And the other fourth common myth is that arthritis only occurs in old age. So we'll tackle all of these myths one by one. Other ones are painkillers are very, very dangerous. You should not even take one tablet of it. Your kidneys will fail forever. And steroids are also very, very, very dangerous. Don't take them at all. So let's go discuss the broad categories of arthritis. The first one, the most common type of arthritis, one of the most common type is gout, which is due to high uric acid levels. This presents as the patient will give history of repeated episodes of joint pain, which is usually in the toe and the ankle, and the patient is normal in between. So a usual history symptoms would be that the pain comes and goes. Like the big toe or the ankle will get pain, swelling, redness. It will stay for 5-7 days and then it will go away. And the patient will be normal. And it will again come back after a few months or years, and again episodes will happen. Eventually, if left untreated, then the episodes become more frequent, and eventually, again, if left untreated, then the episodes become constant, like the patient is in pain throughout regularly. But it is very important that it initially starts with painful episodes, with the patient being normal in between. It is related to diet. If the uric acid is high, you have to avoid red meat, fish, alcohols, soft drinks, and fruit juices. Then the most common type of arthritis is actually osteoarthritis. Osteoarthritis is the wear and tear of joints. So all joints have cartilage, which is a lubrication in the joint, which prevents friction between the bone surfaces. There are two risk factors for developing osteoarthritis. The most important being age, second being weight. So age is not under your control. It is very common under in old age. And if your weight is high, then you commonly people develop osteoarthritis of the knees and the hips. This, like I said, is depletion of cartilage usually occurs in knee and the hip. There is usually no swelling or only mild swelling. It is more pain while using walking that the pain is there. Here, the main treatment is painkillers, platelet therapy, weight loss, and at late stages, surgery. Then the other type of the main one topic which we treat is inflammatory arthritis. It is the one in which the immune system is attacking the joints. It can occur at any age, but the common age is young and middle age. There is very less role of diet in it. Smoking can increase the risk, and it requires early treatment with immune suppressing and immune retraining medicines. Okay, so among them, the most important one, I mean, in which the treatment has to, I mean, all require treatment. Gout also requires treatment early, but in rheumatoid arthritis, the treatment is to be started as early as possible. So this is a classical photo of a patient with a gout attack. The big toe becomes hot and swollen and very tender patient, and it becomes suddenly develops. Patient will sleep fine in the um, uh, evening and in the night, and when the patient wakes up, there is sudden pain and swelling in the big toe. It can also become huge and involve the whole foot as well and the ankle also. So it usually starts with the big toe or the foot or the ankle. It usually occurs in males. In males, it can occur at a young age as well. In females, it is usually more common after menopause. So after 45 years of age. In males, it can develop in young age or does not occur in children. But even in 20, 30-year-old males, it can happen. Every young, middle, old age males can develop it. Females, like I said, usually after menopause, after the age of 45, it can occur. It is commonly misdiagnosed. It is both underdiagnosed and overdiagnosed. Sometimes the diagnosis is missed because during the attack of the gout, uric acid arthritis, during the attack, the uric acid might be normal. Actually, the uric acid should be checked after the first 7-10 days of the attack. So it is underdiagnosed if the uric acid is found to be normal during the attack. It is also overdiagnosed. The patient might have rheumatoid arthritis, but actually has multiple pain and joint swelling from beginning. But because the uric acid is high, it is mislabeled as gout or uric acid. If no joint, very importantly, people um, um, take treatment for uric acid, medicine for uric acid, even if they have no symptoms. If there is no joint pain history or kidney problems, then only diet changes are required. Or kidney stones. If there is no kidney stones, kidney function is normal, there is no joint pain, then only diet changes are required. Medicine is only given if either there is kidney stones, kidney issues, or joint pains. And medicine once started has to be taken long term. So we have discussed gout, which is a very common type of arthritis. Other one is osteoarthritis, which I said is the wear and tear of the joint related to age and weight. So this is the knee joint. Um, uh, this this is the femur. This is the tibia, the lower bone. This is the joint. And this blue thing which you see is the cartilage, which is the lubrication between the two bony surfaces to prevent friction. With age and weight, it develops, the gaps in the cartilage develop, causing friction between the joints and irregularities in the joints. This and you get crackling sound whenever you move the knee, which is known as crepitus. Pain while walking the stairs or getting up. This is known as osteoarthritis. So the main treatment of osteoarthritis is exercise, weight loss, pain decreasing medicines. There are cartilage supplements, tablets which can help but have not shown clear benefit in this disease. There is also platelet therapy, which we call platelet-rich plasma therapy, which can help in early stages of the disease. However, once there is late stage of the disease, patient is in a lot of pain, mobility is severely disturbed, then the treatment is knee or hip replacement, which is very commonly done in osteoarthritis. Then let's discuss inflammatory arthritis or autoimmune arthritis, the most common being rheumatoid arthritis. So it is of inflammatory arthritis, again is of many subtypes. The two common one beings are rheumatoid arthritis and ankylosing spondylitis. So rheumatoid arthritis both can occur in male and females both, but rheumatoid arthritis usually occurs in young to middle-aged females. It presents it with multiple joint pain and swelling. Gout, like I said, usually starts with one joint, with repeated episodic attacks, and the patient is normal in between. In rheumatoid arthritis, patient usually there are no asymptomatic intervals. Patient has pain daily, months together, regularly. Their stiffness and the pain is characteristically worse in the morning. And if not treated normally, early, it can lead to deformities. The shape of the hands, feet, joints will get deformed. So it is very important to treat. It is treated with immunomodulatory drugs, which are drugs which retrain the immune system. These drugs usually take 2 months to start acting. For initial 1 or 2 months, we give a low dose of steroid for immediate symptomatic benefit, for immediate pain and relief. Eventually, but we stop the steroids in 2 months because long-term steroid therapy can have side effects such as weight gain, blood sugar raise, and weakening of the bones. The second more common type of inflammatory or autoimmune arthritis is ankylosing spondylitis. It occurs usually in young males. They present with long history of back pain, stiffness. They can also have pain in the leg joints, swelling in the joints, in the leg joints in 30% cases. There also the pain and stiffness is worse in the morning. And if not treated, it can lead to limitation and motion of the spine. Patient will have difficulty in bending forward. Eventually, if left treated, the neck will also get involved and there will be difficulty in neck motion. Both need early treatment. So here we give exercise, painkillers, and also immunomodulatory drugs. So this is what will happen if you ignore your rheumatoid arthritis symptoms. Like I said, unlike gout in which diet plays a role, in rheumatoid arthritis, diet plays minimal role. It is usually, patients usually develop it due to bad luck. It occurs up to 1 in 100 middle-aged females. And if left untreated, the fingers get deformed and there is a lot of limitation of motion and difficulty in doing daily activities. So if you have symptoms of rheumatoid arthritis, multiple joint pain and swelling, early morning stiffness, please meet a rheumatologist near you as soon as possible. Ankylosing spondylitis, this is a normal posture. If you left it untreated, the young male will have a stooped posture with difficulty in neck motion as well. And the bones will get fused. So this is a normal vertebra. This is a normal vertebra. Normally there is gap between the two, but here bony bridges have developed, connections have developed between the vertebra, which is we call as bone fusion, ankylosis. There are other common types of arthritis such as chikungunya arthritis, which is common in Delhi. Patient will have chikungunya, and 1% of them will have long-term arthritis. Other common type of autoimmune arthritis is psoriatic arthritis. Psoriasis is a skin disease. Around 30% patients of psoriasis also develop arthritis. So let's come back to the myths. Arthritis is not treatable. Like I said, it is treatable but not curable. It is somewhat like diabetes. I would not say that the treatment is definitely lifelong, but it is long term. If you don't treat it, then you will develop a lot of joint problems and your quality of life will be affected. But if treated early with the proper amount of drugs, then you can lead a normal life with and do all your daily activities, jobs, family life, everything. Second myth was diet relation of diet. Like I said, the main relation is with gout, uric acid arthritis, in which diet changes are required. You need to decrease if your uric acid is high, you need to decrease the protein in your diet. Most high sources of protein are red meat, fish, these two things. Other, you have to avoid alcohol, and soft drinks and cold drinks have high amount of fructose, which can precipitate a gout attack. Other sources are like pulses, dal, rajma, chole, soybean that have to be decreased. Or the second, osteoarthritis, it is the weight. If you're overweight, then the risk of developing osteoarthritis is high. So you should decrease your weight. In rheumatoid arthritis and other autoimmune arthritis, diet has a minimal role. Diet changes don't usually lead to significant change in the pain and swelling. Like I said, uric acid causes gout, which is a common arthritis, but it does not cause all type of arthritis. It is only one of the causes. So just because your uric acid is normal doesn't mean that you don't have arthritis. And the fourth myth which we tackled was arthritis only occurs in old age. Like I said, it can occur at any age. Osteoarthritis usually occurs in old age. Gout occurs at any age except for children in males. In females, it occurs after 45, after menopause. Rheumatoid arthritis can occur in all ages, but is common in young to middle-aged females. Painkillers are dangerous if you have pre-existing kidney disease. If you have kidney disease, if your creatinine is high, you should avoid painkillers except for paracetamol and tramadol. But paracetamol and tramadol are okay if even if your kidney is affected. Painkillers can be taken for symptomatic relief for short durations. If you keep on taking painkillers like Brufen, diclofenac, long term, then your kidney might get affected. Steroids, if given for a short duration at a low dose, are good for symptom relief for initial 2 months, but they should always be taken in consultation with a doctor. If you keep on taking a lot of arthritis patients, just keep taking steroids on their own without consulting a doctor, then they develop side effects like lot of weight increase, um, uh, weakening of the bones, diabetes, cataract, muscle weakness, and lot of long-term side effects. So other disorders in rheumatology which we see is, we'll quickly go through them. One is Sjogren syndrome, in which there is dryness of eyes, dryness of mouth, and fatigue. Fibromyalgia, in which there is widespread body pain, and there are other complaints as well, but there is no joint pain or swelling. Scleroderma, in which there is skin tightening, and lupus, in which the young females develop hair loss, mouth ulcers, butterfly rash over the face, and kidney problems can also develop. Other rare disorders like myositis, vasculitis, we also see. These usually patient goes to the physician, medicine doctor, and they refer to us because these are rare problems. So just to see common symptoms in rheumatic diseases are multiple joint pain, widespread pain, low back pain, which is worse in the morning, long term, skin tightening, skin thickening, mouth ulcers, skin rash, hair loss, dryness of eyes, dryness of mouth, or unexplained fever. If you have any of these, you show to a physician, and if they ask if a rheumatology consultation is required. For example, Raynaud's phenomena is very common when you dip your hands in cold water. Do they turn white or blue? Then the patient might have a rheumatological problem. They should come and see us. That's it. Thank you. We can take questions now. So the first question is, I have developed continuous pain in my right knee since a few weeks. It becomes quite painful when my foot is at rest for a
So
long time.
queries are on chat box.
Yeah. It feels better after I walk and exercise a bit. Could this be onset of rheumatoid arthritis? So in rheumatoid arthritis, eventually multiple joints get involved. Since you have only in the right knee for few weeks, I would not be worried about rheumatoid arthritis right now. If there is significant amount of swelling which develops, then and or if there is uh, pain in other joints as well, then you should go and get tested for rheumatoid arthritis. You might need some blood tests and an examination. If you could tell your age also, that would be good. If pain in the knees in old age is usually osteoarthritis. So if your age is more than 50 or 60, then and pain in the knee, that is more likely to be osteoarthritis. Okay. Second question is, so what would like to know some of the best proven methods that help in maintaining mobility of patients with rheumatoid arthritis. So this point I want to tell a point I have to get across. In rheumatoid arthritis, the treatment is only and only taking medicines regularly. Most benefit, 90% of the benefit is by medicines. Taking the right medicines, the number of medicines can be multiple. Showing the doctor regularly is very important. Lifestyle, diet, and exercise have only 5-10% role. Main thing is to take your immunomodulators, whatever drugs like methotrexate, hydroxychloroquine, sulfasalazine, whatever the rheumatologist writes, those need to be taken regularly. Your blood tests need to be done regularly, initially once a month for 2 months and every 3 months to make sure that no side effects are happening. So main important thing is taking your medicines. So the third question is painful knees and clicking sound when climbing stairs. So this could be a beginning clicking sound, like I said, could be crepitus, which is the friction in the joint, could be beginning of osteoarthritis. You should see a doctor, get an X-ray done to see how much cartilage is, if the cartilage in the joint has decreased. If you're overweight, try losing weight. Other important exercise to do in osteoarthritis for the knee is quadriceps strengthening exercises. So those should be done. Okay, then next question is, I have been dealing with high uric acid gout, which is under control. However, about 25 days ago, a heavy weight, approximately 35 kg, fell on my toe. I underwent an X-ray which showed no fractures. The doctor advised taking painkillers, calcium, strapping, which was removed after 7 days. Despite following the treatment, the pain and the swelling have not subsided. So there can be two things. Maybe the X-ray did not show a fracture, but there was a bony contusion or soft tissue injury. So that can only be picked up on MRI. So if the things are not improving, you should consider getting an MRI of the foot. Second could be sometimes trauma can precipitate a gout attack. So if your uric acid has been normal for quite a long time, then should be okay, unlikely to be a gout attack. But if your uric acid is high, then it could be that has been a gout attack and you need treatment by a rheumatologist. You might need painkillers, a drug called colchicine, or a short course of steroids. So if your uric acid has been normal, go ask the doctor to prescribe an MRI. If your uric acid is high, then it could be a gout attack. Get medicines like painkillers, short course of steroid or colchicine by consulting a doctor. Okay, the next question is, I had fever back in 2010. I am avoiding cold and ice items since then, but I am still having joint pains during winter time. What treatment should I take? So if you're having joint, so a lot of times the arthritis increases. You might have a mild arthritis which only comes during the winters. So you need some tests. You need some tests like rheumatoid factor, anti-CCP, and ANA. These three tests you should get checked to check if there is some mild autoimmune arthritis. So our rheumatoid factor, anti-CCP, and ANA test. Get this done. Go meet a physician or a rheumatologist near you. Okay. Next question is, please let us know about cervical spondylosis. So again, usually I don't see spondylosis. Spondylosis usually a neurologist, neurosurgeon, or a pain specialist or a orthopedician see. Spondylosis is wear and tear of the spinal, cervical or the neck spine joints, in which the common symptoms are neck pain, which radiate or travel to the arms, which is a shooting pain. Usually, the treatment is given is neck strengthening exercises. If the pain is severe, you might be asked to wear a cervical collar or a neck collar. You might be given nerve numbing medicines like gabapentin or pregabalin. Again, I would show an orthopedician near you for spondylosis. Next question is, I am having knee pain and feet pain, mostly in the morning when I wake up. I have considered a doctor who suggested to wear padded footwear, which while this helps with the pain, I do not feel this permanent solution. So again, I would get, since if you've been doing this pain has been there for quite a while, I would get tests for autoimmune arthritis, which are RF, anti-CCP, ANA, and HLA-B27. I would get these 4 tests done and I would meet a rheumatologist or a physician near me. Then next question is, I am suffering from rheumatoid arthritis, taking medicines. How can I control it? Is medicine required for lifetime? So medicines are required long term. They might be required lifetime. A lot of people get depressed that my medicines are long term. I mean, I understand that nobody wants to take medicines lifelong, but in this disease, frankly, right now there is no permanent cure. If your doctor, unless your doctor tells you to stop the medicine, don't stop your medicines. Unless you have some side effects, do not stop your medicines. If the medicines are working, then well and good. If they are not working, get them changed or get the doctor to increase the medicines, the immunomodulators. How to ensure joint pains healthy? So, okay, so in general for joint health, I would say do not smoke. If you're overweight, lose weight. If because smoking increases the risk of rheumatoid arthritis. If your uric acid is high, then decrease the protein in your diets. Do deep breathing exercises. That would be the main thing. So again, I will repeat: do not smoke. If you're overweight, lose weight. If your uric acid is high, decrease the protein in your diet, and you can do deep breathing exercises like in yoga. Okay, what is benign joint hypermobility syndrome and which specialist can treat it? Okay. Benign joint hypermobility syndrome is one in which your joints are hypermobile. This usually the joints are hypermobile since birth, and they patients develop chronic aches and pains, long standing. Sometimes they will develop ankle pain, sometimes back pain, sometimes elbow pain, and they're common. They're disturbed with pains a lot throughout their life. There is usually not much swelling in the joints, and usually the range of the motion in the joint is not affected. So usually the pain, again, it's a lifelong thing. You have to make sure that there is no other reason of pain which is exaggerating it. So check your vitamin D levels, check your iron levels, check your thyroid levels, and check your B12 levels. This everybody should get checked. In fact, ferritin levels for iron, B12 levels if you're a pure vegetarian, because pure vegetarians have low B12 levels a lot of times. Vitamin D, everybody should get checked because it is very common, and thyroid levels. So everybody should get it checked, but benign joint hypermobility syndrome, people should get it checked every 1 or 2 years. If any of them are disturbed, get them corrected. The other thing to do in benign joint hypermobility is to um, slowly strengthen your muscles. So you have to do slow weight training, guarded muscle strengthening exercises in with a weight trainer. For example, like normally a normal person starts weight training, they can straight away start with half an hour or 45 days, 45 minutes a day. But for a patient with benign joint hypermobility, I ask them to start 5-10 minutes for the first 1 or 2 weeks. Then make it 15 minutes for 2-3 weeks. Then make it 20 minutes. So go very slowly to strengthen your muscles. Okay. Next is if and benign joint hypermobility patients, usually they should see a pain specialist, pain physician near them. Okay. If a patient has rheumatoid arthritis and diabetes, then what should be the diet? How can there be food? Like I said, rheumatoid arthritis, the diet plays minimal role, no smoking. For diabetes, that's a lifestyle disease. Decrease the sugar and carbohydrate and fat in your diet. Okay. Benign joint hypermobility I have discussed. Um, Next question is, I have been diagnosed with ankylosing spondylitis where I used to get stiff on my backbone till neck when I'm idle. How now my neck's posture got changed. Right now I'm not taking medicine. Is it a curable disease? I'm proactively standing, workout, and walking without medicine. It is not a curable disease, but it does not require lifelong medicine. Rheumatoid arthritis usually requires long-term medicine, but ankylosing spondylitis patients can be without medicines as well. Back stretching exercises have to be done lifelong. Daily 15 to 30 minutes back stretching exercises every day. Avoid sitting in the same posture for too long. Stretch your body in between every 1 or 2 hours. Badminton, volleyball, and swimming help a lot. Swimming is best in ankylosing spondylitis. Okay. Uh, any other questions? We can wait. Okay, next question is uh, again, benign joint hypermobility has to be managed lifelong. It is not curable. Okay. Next thing is carpal tunnel syndrome post pregnancy. So carpal tunnel syndrome is a disease in which the nerve near the wrist joint gets compressed. Common causes are again post-pregnancy, thyroid issues, and arthritis. So I would get checked for arthritis and thyroid issues. Usually requires a split to wear some nerve calming medicines like pregabalin, gabapentin. Some require a local steroid injection near the nerve, and sometimes a surgery to release the pressure on the nerve is required. Is arthritis become genetically? At what age ones get arthritis issue and what precautions to take? Arthritis is usually not considered a genetic disease, but somebody if in the family has it, then your chances increase than a normal population, but it is not considered a genetic disease. Like I said, it can uric acid occurs in males young to old, not in children. In females, uric acid issues occurs post-menopause. Osteoarthritis occurs after the age of 50 years. Rheumatoid arthritis occurs young to middle-aged females. Ankylosing spondylitis occurs in young males. So, in general, arthritis can occur in any age. Uh, does RA have impacts on lung functioning? So, yes, around 5 to 10% of rheumatoid arthritis patients can have lung involvement as well. Common symptoms are dry cough, shortness of breath on walking. If that is happening, meet your rheumatologist, meet a lung doctor. They will do a pulmonary function test. You might require a chest X-ray or a chest CT scan to see if the lung is getting affected. That disease we call interstitial lung disease. Have swelling and pain surrounding the right knee, unable to walk and do work regularly. So this is a significant symptom. If you have just started having it can be due to any type of, it can be reactive arthritis, it can be gout, it can be infective arthritis, it could be beginning of rheumatoid arthritis. I would say immediately meet a physician or a rheumatologist and get treatment for it. Swelling in the joint is arthritis. And if it's in the single joint, it could also be an infection. So meet a rheumatologist or a physician near you. And we'll wait for 2-3 minutes more if there are more questions. I think there are no more questions. Should we end the session?